This is Dr. Surindher. I am the Director of Aesthetics Plus Clinics. Welcome to our channel. Hello everybody, welcome back. What is a non-surgical rhinoplasty, or what is rhinoplasty with fillers? This was a query which we are going to answer today. A non-surgical rhinoplasty is basically correction of the nose using non-surgical methods. The most common being using a filler or in combination or alone in combination with threads. So what are fillers? Fillers are basically hyaluronic acid fillers that we use, and there are other varieties also. Most commonly are the hyaluronic acid fillers that we use. Now these are basically molecules artificially created which will increase the volume. They will also take in some water and increase and give a more volume replacement. So rhinoplasty is a procedure where we have to actually change the structure of the nose, and when we are doing the procedure we actually do some changes to the skin, we do some changes to the cartilage inside the framework, and of course changes to the bone. So all these changes are not possible when you're doing a non-surgical rhinoplasty. Non-surgical rhinoplasty is basically, there are two things which can happen. One is basically to improve the dorsum of the nose. That is, if your bridge is small or if it is depressed on the side, you can build it up. You can build it up by adding fillers, so that gives you a better contour and a more straighter nose on the nose to look at, and you have a straighter dorsum. The other thing that you can do is you can put in some fillers to correct any minor deformities post a rhinoplasty. You might have a small bump or a small depression which can be filled up with using a non-surgical rhinoplasty. A third option, which is not very common, is something to do as a thread lift. So if by chance, if you have a small hump on the nose, or if you have a depressed or a hooked nose, then that small portion of the nose that can be corrected by using a small thread lift, where we actually do a small cut from underneath the nose, and along with the threads your tip is pulled up and it is reduced, and the hump gets merged with the volume. Small hump corrections can also be done with the filler. So these are your options for a non-surgical rhinoplasty. We often get queries also that they want to do a reduction of the nose, and is that possible with non-surgical methods? Sadly, non-surgical rhinoplasty will not cause a reduction of the nose, because you have to reduce the skin component, you have to reduce the cartilaginous component, you have to reduce the bony component. So all that is not possible by non-surgical methods. You have to actually cut and remove stuff there. So that is why for a reduction, most commonly it is a surgical procedure. But if you just want an augmentation of the dorsum, or you want some minor changes in the nose, making it a little more sharper, making the dorsum a little more better, then yes, you can do it with fillers in combination with threads or alone with fillers. And it's usually underdone under local anesthesia, and it takes about half an hour to 45 minutes, and the results will last you anywhere between 6 months to about a year, depending on what kind of filler is used and in what plane. And but again, that also has its finesse. You need to do it in the right portions, in the right place, so that it just gives you the best results possible without causing too many issues. Thank you.